I've always said this is one case that proves the old adage that a pound of prevention is worth, an ounce of prevention is worth a pound of cure. So, budget watchers, we turn to health experts. Dr. Osterholm, as we head into the summer season, summer travel season, families are getting together. People will be crowding into airports and beaches and all sorts of places, probably not thinking about COVID, but I thought it'd be a good time to check in with you on, where we stand with this disease, just sort of as a general proposition.
Well, I think first of all, it's fair to say that we're still living in a COVID world. It's still out there. It's still a challenge for us, but it's a very different world than we had in the first 2 to 3 years of the pandemic. When we now have a sufficient amount of immunity in the population that lasts for at least some months, that has meant that we're seeing many fewer infections and a big reduction in the number of deaths. Right now, we're at about 250 to 270 deaths a week in this country, but that's down many, many fold to the thousands that were there in 2001. I think one of the challenges we have, and this is where we really all need a dose of humility, is to say, what is the next shoe to drop? This virus continues to change. It changes even much faster than flu viruses change in terms of its genetics, which means that it can, in fact, still be a challenge in the future if we see the right variant, or from our perspective, the wrong variant emerge that does have a higher level of immune escape than we currently see with the ones we have. And with time, as waning immunity occurs. One of the things we know with COVID in general is that, like the other coronaviruses, you may get protection after being vaccinated or having been infected, but that may only last for months in terms of protection, particularly against severe disease, hospitalizations, and deaths. And so, we're still in an uncharted territory in terms of what's going on.
Yeah, I mean, I used to track these numbers pretty closely, during the pandemic, hospitalizations, deaths, new cases. It's really hard for the non-expert to do that anymore. Do you, are there any trends that you see, like new variants that might be on the horizon?
We do. In fact, there are ones that we call flip variants. These are ones that have descended from the original Omicron strain, then went through a strain called JN1, and then now to where it's at. And so this virus is constantly changing. When we look at the Southern Hemisphere's activity right now, particularly Australia, New Zealand, given that they're in their winter time right now, of course, which is you'd expect to see seasonal viruses, influenza, RSV, and of course, COVID take off. We did see a slight increase. I wouldn't say slight in the sense that it doubled in numbers, but there were very small numbers of people who were hospitalized in Australia and New Zealand last month, but those numbers have come back down substantially. So it was a short-lived blip, you might say, in what was already a very small number of cases. So that's still there. And that was associated largely with this new flip variant we call it taking off. And we're now beginning to see that flip variant take off in the United States. We'll have to see between now and flu season, the typical respiratory season, what it's going to do. I'm not sure what it's going to do yet.